You feel fine. No pain, no obvious problems. But here's the truth. The most dangerous prostate symptoms after 40 are often silent, and men don't notice them until it's too late. In this video, we'll show you the 5 silent warning signs men over 40 miss, why they matter, and the simple steps you can take right now to protect your health and your future. Let's start with the first sign, one you might already be ignoring every single night. For many men over 40, prostate changes begin quietly. No sharp pain, no dramatic symptoms, nothing that makes you rush to the doctor. And that's exactly why it's dangerous. The prostate is a small gland, but it plays a big role in urinary health, sexual function, and even hormone balance. As it enlarges or becomes inflamed, the early warning signs can be so subtle that most men brush them off as just aging. Waking up once or twice at night, needing an extra minute in the bathroom, or feeling a bit of pressure in the lower abdomen. These might not seem serious, but ignoring them can allow problems like benign prostatic hyperplasia, chronic prostatitis, or even prostate cancer to progress unnoticed. The truth is, prostate health isn't just about avoiding disease. It's about staying strong, energetic, and vital in your second prime. And it all starts with spotting the silent signals early. Most prostate problems don't start with sudden pain. They creep in with small, easy-to-ignore changes. One of the first signs is frequent urination, especially at night. If you're waking up more than once, your body is telling you something. Another silent warning is a weak or interrupted urine stream. You might notice it takes effort to get started, or that stopping and starting becomes the new normal. Some men also feel like their bladder never fully empties, leaving behind a nagging sense of pressure. Even subtle pelvic discomfort or a dull ache in the lower back can be a sign the prostate is under strain. And here's one that men rarely talk about: changes in sexual performance, such as reduced strength of ejaculation. Alone, each of these symptoms may seem minor, but together, they form a picture your body wants you to see. These are not just getting older. They're silent signals worth paying attention to. It's tempting to shrug these signs off as harmless inconveniences, but the truth is, silent prostate symptoms are early warning lights on your body's dashboard. Ignoring them can allow conditions like benign prostatic hyperplasia, a common enlargement of the gland, to slowly restrict urine flow, leading to infections, bladder damage, and constant fatigue from poor sleep. In other cases, chronic inflammation, known as prostatitis, creates a cycle of discomfort that wears down energy and focus. Most concerning of all, subtle symptoms can sometimes mask the early stages of prostate cancer, when it's most treatable. By the time stronger pain or blood in the urine appears, the disease may already be advanced. Here's the bottom line. Your prostate affects more than just urination. It influences hormone balance, sexual health, and overall vitality. Recognizing and addressing these symptoms early isn't just about avoiding disease. It's about protecting your energy, confidence, and quality of life in your second prime. Why do prostate problems become so common after 40? The first reason is simple: age. As testosterone slowly declines and estrogen rises, the prostate becomes more sensitive to growth signals. Genetics also play a role. If your father or brother had prostate issues, your risk is significantly higher. Lifestyle is another silent driver. A diet heavy in red meat, processed foods, and excess alcohol fuels inflammation, while obesity and inactivity place extra stress on hormone balance. Even something as simple as sitting too much can reduce circulation in the pelvic area, affecting prostate health. Environmental toxins, chronic stress, and poor sleep further weaken the body's defenses. Put together, these factors create a perfect storm. But the good news is, most of them can be changed. By understanding where your risks come from, you gain the power to lower them, protecting not only your prostate, but also your long-term strength, vitality, and independence after 40. Here's the good news. While age and genetics can't be changed, the biggest risk factors for prostate problems are within your control. And small, consistent steps can protect your health more than most men realize. The first is screening. A simple PSA blood test and digital rectal exam, starting in your 40s or earlier if you have family history, can detect problems while they're still easy to treat. Too many men avoid these out of fear or discomfort, but a few minutes once a year can save your life. Next is diet. Research shows men who eat more vegetables, fruits, and omega-3 rich foods have healthier prostates. Cruciferous vegetables like broccoli and cauliflower contain compounds that lower inflammation. Swap processed meats and fried food for lean protein and healthy fats. And don't underestimate hydration. Water supports proper urinary function and flushes the system. Then there's movement. Regular exercise helps balance hormones, improves circulation in the pelvic region, and reduces obesity, one of the strongest predictors of prostate trouble. Aim for strength training twice a week and 30 minutes of brisk walking or cardio on most days. Supplements can also play a role. Zinc is crucial for prostate tissue. Vitamin D supports immune function and hormone health. And herbal options like saw palmetto have been studied for easing urinary symptoms, though results vary. Here at Second Prime, we've linked the exact supplements we trust below. If you'd like to support the channel at no extra cost to you, those links are ready in the pinned comment. Finally, watch for red flag symptoms. If you notice blood in your urine or semen, sudden weight loss, or constant bone pain, see a doctor immediately. Acting quickly can mean the difference between early treatment and a far more difficult fight later. The takeaway is simple. Prevention isn't complicated. It's about consistency. Yearly screenings, an anti-inflammatory diet, daily movement, and smart supplementation form a shield around your prostate and protect your energy, strength, and confidence in the decades ahead. Your prostate health is too important to ignore. And the truth is, small daily changes can protect you for decades. If you found this video helpful, subscribe for weekly, science-backed tips to thrive in your second prime. And if you want to take the next step, we've linked the exact supplements we use for prevention in the description below. They support the channel at no extra cost to you. And they support your health starting today. If this video helped you in any way, even one small change you'll try tonight, leave a like. It tells the algorithm to show it to someone else who might need it. And if you want more clear, science-backed ways to protect your body and sharpen your mind after 40, stick around for more. Your second prime isn't about going back. It's about staying sharp, steady, and strong.